and everything, they're happy. As they transport up from the basal layer, up through the other layers of the skin, they tend to flatten out. And when they get to the surface of the stratum corneum, they lose their nucleus, and they're just flat patches. It's a brick and mortar type structure, so the cells are surrounded by ceramics that prevent absorption of things through the skin. Transdermal fentanyl, 2-hour lag time before we see any plasma concentration, and the levels don't really level off. Do you have to go this morning? Okay, good. Level off between 12 and 24 hours, and it takes 30 hours to achieve a maximum concentration. So this depot effect that you were talking about, Dr. Emery, the half-life of the injectable drug is about 7 hours. The half-life after removal of the patch is 17 hours. So there's 10 hours worth of depot in that drug for most people. So it's very plausible that what you're saying is the drug is delivered within the first 48 or so hours, and then the rest of it is just cruising on depot.
David, I'm playing with this in my head. You put a patch on somebody with no fat and lots of fat.
Mm-hmm.
Does the rate of absorption the first 2 days differ?
No. The
patch is empty by the third day.
yeah.
But the patch is empty after 2 days.
Right. Okay. The drug delivery
Dosing that
system,
every 48 hours in a thin person would be the way to
and maybe more
get around that.
Mm-hmm. I mean,
But
they'll tell you.
the rate the first 2 days is the same.
That's right.
Okay.
They'll tell you. They'll say, Doc, after 48 hours, I'm in pain again. So they'll let you know just how quickly you can change that patch. Drug delivery systems for transdermal delivery, in the case of fentanyl, there's 2 types. There's the reservoir type that has the drug in a gel, and in between that reservoir and the skin, there's a rate-limiting membrane. So it's actually the rate-limiting membrane that controls the drug delivery through the skin, not the diffusion of the drug itself through the skin. And the second type, the myelin patch, is a drug in adhesive matrix. So the drug's actually impregnated in a polybutylene, a rubber adhesive, and it's the diffusion of the drug through that matrix that's the rate-limiting barrier to presentation to the skin. Once it gets to the skin, it goes through like a shot. So it doesn't matter if you're fat or thin, it's the delivery system itself that's controlling delivery to the skin.
So then where does whether or not a patient has a good amount of fat to them, where does that impact that fat? Because we've got the rate of delivery system being the same. That's right. Regardless of the body habit.
That's right.
And so then, from what I understand, then with these things, when they're lipophilic, so they're going to actually be stored in the fat.
That's right.
Rather than more delivery to the bloodstream itself.
That's right. Well, it will be both. It will be both. It will be filling up that reservoir in the adipose.
Okay.
Okay, and then once the diffusion is concentration dependent. So it's not that the patch runs out of it. It's just the driver for diffusion. The Fickian driver for diffusion is concentration gradient. So once the concentration in the patch itself falls off, then you lose that driver. But that's when the depot in the skin or the subcutaneous tissue takes over.
Okay. So in a skinny person, do they functionally get a more rapid dose of the medicine? For instance, I guess I would use perhaps a lower dose of the therapeutic patch in a skinny person, but change it more frequently in order to get the same sort of effect as I would in a heavy person.
Yes, clinically that's exactly what we see, because you get these thin people and they get a more rapid peak because you do not have the adipose, which is
controlling that more.
After it gets through there, it just is right. It hits the skin and it comes right in. You got the fat. That is supposed to be the barrier number 2 that takes it and stores it and leaches it out of the system. Okay. And if you don't have the fat, it hits that skin, it sucks it in, and you get this peak.
I just want to point out that's a lot more expensive to hit every 48 hours.
It really
it's already an expensive system.
It really is. come down though, but we're still talking $100 a month for probably a 50 microgram patch.
So then if you're changing it 2 days instead of 3 days,